Disclosure. Every medical professional must have a clear understanding of the components of open communication with patients, also called disclosure. Unfortunately, many trainees and junior faculty do not have the opportunity to observe provider conversations with patients around adverse events. Their first experience is the first time they're responsible for the conversation. In this module, we will discuss the context of open communication and disclosure, incorporate the components of disclosure into patient communication, demonstrate the ability to disclose error following established guidelines, and understand the potential impact of medical error on medical providers. It's difficult enough to remember to tell our patients everything that will happen in the hospital when events proceed as expected. When an unexpected event happens with a good outcome, let's say an emergency cesarean in labor, we often overlook having a conversation with our patient about what happened, who was there, and what the implications are for the future. So it's not surprising that when an adverse event occurs, the stress of the situation, together with our lack of practice, often leads to poor communication. The Veterans Health Administration defines disclosure as the discussion of significant facts between providers and patients about the occurrence of an adverse event that could reasonably be anticipated to result in harm in the foreseeable future. An adverse event is defined as an injury that was caused by medical management rather than the patient's underlying disease. A medical error can be defined as the failure of a planned action to be completed as intended or the use of a wrong plan to achieve an aim. When an adverse event or medical error is identified, the first steps are for the safe care of your patient. Following her stabilization, you must begin to think about the process of communicating about the event to the patient and her family. You'll need to think about when. Generally, the sooner the better for the initial conversation. Who will go with you? Who should be with her? Who will you need to notify? Where? In the hospital or the clinic? Is there enough privacy in her room? What? You should have a plan for what you want to say. Follow-up plan? You'll need to have one. So let's begin. Your initial conversation with your patient should be prompt, with clear and complete information in non-medical language. Step 1. Explain the event. Step 2. Express regret and apologize. Step 3. If appropriate, accept responsibility. Step 4. Express a commitment to finding out what happened. Step 5. Set up a time frame for follow-up. Here are some ideas of what disclosure sounds like. Step 1. This is what happened, and this is what we intended to happen. Be clear and use non-medical language. Go step by step. Don't forget to talk about the future. Don't speculate if you don't know. Step 2. Express regret and apologize. I'm so sorry that this happened. Step 3. If appropriate, accept responsibility. Our team failed you and your family. This shouldn't have happened. Our system broke down. Step 4. Express a commitment to finding out what happened. We are going to look into this to make sure it doesn't happen again. We work with a team at the hospital to investigate events like these. Step 5. Set up a follow-up plan. When and with who. We are going to meet with you again when we have more information. Who should be involved with the disclosure? The attending physician. The primary person involved is responsible for the disclosure. The physicians who are present, including trainees, should be there as well. Your risk management team, with whom you should consult beforehand. The patient, and anyone on the patient's team. You should ask her whom she would like to attend. For example, her family and a patient advocate. Where should this happen? Anywhere the patient is, as long as she has privacy. What else should I do? You must sit down on the bed or in a chair. Put down any notes or charts in your hand. Look her in the eye. Make sure you'll have enough time to sit with her without being called away. Answer any questions truthfully, especially if the answer is, I don't know. Often in obstetrics and gynecology, medical harm is due to late recognition of complications of the patient's underlying medical condition. The term failure to rescue is one way these events are referred to in the patient safety world. One way to frame this conversation to the family is like this. What can happen to women with this condition is, usually we're able to recognize it, and unfortunately today we didn't recognize it as soon as we should have. Generally, the more serious the harm, the more people who will become involved. If the patient is too ill to participate in initial conversations, The situation must still be discussed with family members and with the patient as soon as she's able to understand the conversation. What happens after the disclosure? To the patient and the family, it would be normal to have any or all of the following: anger, sadness, guilt, and anxiety. To the care team, all of these can happen. If they happen to you, please seek support. Your hospital has a team to help you manage. Behavioral symptoms: insomnia, distraction, and loss of concentration. Emotional effects: shame, guilt, fear, anger, sadness. Cognitive impact: obsessive replay of the event. Physical symptoms like fatigue, nausea, palpitations, or backaches. If you persistently experience any of the above effects, you should take them seriously as they can lead to depression. If you become aware a colleague is struggling, please reach out to them. Your institution has support services available for staff as well as patients and families. What are potential implications at work? A British study of 265 nurses and doctors looked at professional aftermath of those medical providers who were involved in medical error. 43% were involved in error leading to patient harm. 30% of these admitted a negative impact on work performance and/or relationships and colleagues. Providers who practice open communication with patients on a regular basis are less likely to have cases lead to litigation. Practicing open communication, like any simulation, will allow you to improve your skills and remember the steps. It can be used for any less than ideal outcome, either from a medical intervention or from the medical condition itself. Now let's practice disclosure. This patient has an unexpected emergency cesarean delivery. Congratulations! How are you feeling?
Much better, though still pretty sore.
I know how much you were hoping for a vaginal delivery. I'm sorry that a cesarean was needed. There were so many things happening so quickly in the operating room, I wanted to make sure that we had a chance to talk about what happened.
I was wondering what was going on. I was so scared for the baby, and I couldn't understand what everyone was saying.
Why don't we go through it step by step? Then you can ask any questions you might have. Today you'll watch the video of a scene with a patient wrongfully operated on. Following the video, you'll practice disclosure with a simulated family member of the patient. By remembering the following take-home points, you can practice effective disclosure. Open communication should be practiced with all patients, especially those with unexpected outcomes. There are steps to remember to cover. You should always be timely, specific, and use non-medical language. Always involve your team. Always follow up if you said you would. You can delegate the scheduling of this task. Seek help for yourself or peers if you identify you or they are stuck in a dysfunctional coping mechanism.